Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitarice, and today I'm joined by Dr. Ryan Cameron, Vice President of IT and Innovation and Chief Digital Officer for Children's Nebraska. He's also the founder of Bright Foundry, a pediatric health startup incubator. Dr. Cameron has been honored by the AIM Institute as an Innovator of the Year and is also the author of 2 books, including AI 101, a primer on artificial intelligence. Today, we're going to be talking about some exciting news, which is the opening of a groundbreaking innovation center at Children's Nebraska. Welcome to the podcast, and it's a real pleasure to have you on.
Yeah, thank you so much for having me. It's exciting to be here to talk about my very favorite thing in the world, which is innovation. Although I've done the discussions about artificial intelligence, I think people are ready to talk about something else today.
I hear you. When I saw the topic for the show, come across from all of our, sort of producers, I say producers like we're some, big official show, but from our organizer of this thing. And it was around the Innovation Center, specifically related to pediatric care. I thought that was a phenomenally interesting topic, and AI certainly is all over the place, but really excited to jump into something a little new. Which is obviously the Innovation Center. So first, congratulations. I mean, that is just huge news. And where I'd love to start is if you can give us some context of what led you to the initiative and sort of the journey to design and create it, and why this is unique.
Yeah, it's a really great story. First and foremost, one interesting thing about Nebraska is we have community philanthropy and support that's second to none. And, it is sometimes in people's minds what they would think of as like flyover country, or, it's mostly just, agriculture and farms. And that's a very, significant part of what Nebraska does. But we have, cities and everything else that, you would expect in a major state. And the Mammel Family Foundation was started by a gentleman named Carl Mammel. And he and his family have been very active in supporting a lot of community initiatives across the state. They gave us a transformative gift that made it possible to really start the Innovation Center. Innovation's been something that's a core value at Children's Nebraska, and that's something that's pretty consistent at many of our peers and other pediatric providers out there. It's part of what we do. So to formalize that and to have a space and a place for people to meet and to discuss and to research, we're really hopeful it's going to be a catalyst that continues that transformation and helps us bootstrap a lot of the solutions that are direly needed in pediatrics these days.
Yeah, it's fantastic. And I mean, for those folks that view Nebraska as a flyover state, they are obviously not familiar with Omaha and the Maha Festival and some of the awesome things that
they're missing out.
They're
missing out.
That's right.
It's a great place. I have friends that have said, "Hey, you got a 3-day weekend? You need to come visit me." And once they come and they experience how incredible our community is, they want to come back.
Yeah, it's fantastic. It is. It's a great community, and obviously, the work that you're doing, to stand up this Institute for Innovation Innovation Center is just hugely important. There are a number of, as you say, opportunities to improve the way that we care for, our pediatric patients across the industry. I'd like to talk first about one topic that's on everybody's mind, I know, around accessibility and access. We know that access is a problem, across the country and across all demographics. But I can imagine that when we start talking about pediatric care, there are probably some unique challenges. So I'm curious, what are you guys doing in that space? And is that part of, the opportunity that you see in terms of improvement?
We absolutely do. A key focus for the Mammel Innovation Center at Children's Nebraska, it really centers around access to care, telehealth, telemedicine. Those 3 buckets are just so critical to where we're going to go. One fact I'll give you just to kind of illustrate the significance of that is if you look at both venture capital money and you look at the level of activity with startups that are focused in healthcare, less than 1% of that is focused on pediatrics.
Wow.
And you contrast that to a statistic that shows us roughly around 22% of the patient population in the United States requires pediatric care. So really what we're witnessing is as baby boomers transition in life, a laser focus on providing care for them, which is critical and important. But we also see this wake left behind with smaller generations. So whether it's millennials or Gen Z or Nexters, we see that a lot of the therapies that they need, a lot of the solutions that they need, they really don't get the attention that they deserve. And so the Innovation Center is really trying to address that. Children's Nebraska saw at least one patient from every state in the United States last year. We're never going to get to a point in pediatrics where we recruit our way out of the staffing crisis that we face. There's just not enough providers, not enough specialists. And we have a lot of kids that need our help and attention. So we're leaning on technology to try to empower and help our staff and all of our providers and caregivers so that they can really focus on patient time and not kind of the transactional things historically that they've been burdened with.
Yeah, it's really interesting. And obviously telehealth and telemedicine, it feels like over the course of time has sort of, ebbed and flows in terms of, the position of those types of solutions in the industry. And it seems like now there's, certainly a re-energization, right? I don't know if that's a word, but there's certainly new energy around telehealth and telemedicine. And again, I'm sure that there's probably some very, specific ways that this relates to the strategy around pediatric care. So can you go into a little bit more detail about how you guys are looking at telehealth and telemedicine in the space of pediatrics?
There's two things that are happening across healthcare and then specifically in pediatrics that really have kind of opened the door to making this valuable. If you were to ask anybody even 10 years ago, 5 years ago, are wearables really creating positive health outcomes? Right. It would be a mixed bag. It's not just Fitbits anymore. It's not, just Apple Watches, but the ability for us to have a continuum of care where we understand what a patient's needs are and what's happening with them above and beyond just coming in to visit when you're sick. A lot of pediatric care really centers on total health and wellness. And so it's, you have a young person who's growing and evolving and changing. And there's lots of, vital signs and data and indicators that happen along the way where we want to have a really great relationship with our patients and our patient families so that we can understand providing the right care at exactly the right time. And that significantly, helps a lot of different care modalities and a lot of different things that we see on the rise. For example, asthma and respiratory illnesses are significantly on the rise. And so now you see some great products that help with remote patient monitoring. So it's much more than, how many steps did you get in today? You actually are starting to get some good data. The other thing that, we're really starting to see is affordability of care and accessibility of care go hand in hand. And a lot of that technology 5 years, 10 years ago was very expensive to the point that it was cost prohibitive. And we also saw that from, federal, state legislature and insurance perspective, those things weren't codable or billable or looked at as what's being called a digital therapeutic. So digital therapeutics and a lot of those devices have become affordable. And so it can be a part of the picture now when you look at the total care perspective for patient families. And we're very confident that, the timing is right where we can start applying some of these technologies to help kids live longer, happier lives.
It's really interesting, and it's such a great point. I mean, patient remote monitoring is a wonderful example where frankly, even in my sort of travels, you hear a lot about it in terms of chronic disease management. You hear certainly a lot about the way that it can foster kind of a hospital at home environment. All of that really, really important stuff, right? But, from a pediatric perspective, and I think about, as through the lens of a parent and what that could mean, from a parent's point of view too, I think that's just such an untapped area of opportunity.
It is, one of our big focus areas for Nebraska, and I would imagine this is definitely true across the country and even across the world, is with pediatric behavioral health. And, we see that the things that you see that are very seasonal. So as kids go back to school and they can get involved in activities, we see respiratory illnesses and broken bones and the things that, commonly occur. But we're seeing an unprecedented rise in the need for behavioral health and wellness. And as an organization, again, leaning on that community growth and philanthropy, we have a brand new pediatric behavioral health center that's going online in a couple of years. And that was all, donated. And otherwise, we wouldn't be able to do that. So Ken Stenson is the gentleman who kind of led that. And the Mammel Innovation Center has to have deep connectivity to those community needs. So we have to understand what's happening with population health and public health. And we see statistics in terms of needs and demands for pediatric behavioral health rising as much as 50%.
Wow.
And there are outright countries that don't have one qualified provider in behavioral health for pediatrics. And so, we're not going to solve it through recruitment. We're not going to solve it from those paradigms. We just have to look at that accessibility. So one of the features that we've got in the Innovation Center we're particularly proud of is we're focusing on launching the very first in the world, a holographic behavioral health care modality. So we've partnered with Steelcase, with Logitech, and a company called Ocular. And the product is called Ocular View, and we're calling it Project Glow. And we'll be launching these across the state, across the I-80 corridor, so that patient and patient families don't have to drive to the metro to visit with their providers. They can do that at a clinic near to them. And they get actually a full-on hologram where they can have critical and tough conversations in a warm and welcoming way. You don't get kind of the Brady Bunch or the Hollywood Squares boxes that you get in a traditional web conferencing meeting. So that's one example of many that we're really laser focused on to try and address that need that you mentioned.
I'm curious about where the idea for that came from. That's the first time I've ever heard of something like that. Not even in pediatrics, but just sort of across healthcare. And I know that there are a number of companies out there looking at how can we leverage sort of this upcoming virtual reality, augmented reality, so on and so forth kind of technology. What was the genesis of that? Did you find inspiration outside of healthcare for it? Was it just sort of part of that sort of incubator of ideas? Where did that actually come from? What's the genesis of it?
Generally speaking, we have the philosophy that the best ideas are going to walk in the door.
Yeah.
It's not super nerds like me kicking around a hacky sack saying, "Hey, I love Star Trek. What if we went that way?" And there's a really big difference between what I would call a thrill ride and an actual digital therapeutic, and you kind of see some of that. So we're very conscientious about avoiding what I would call innovation theater, or just doing something because it's novel and out there. But I will give you one of my secrets. I'm giving away kind of some secrets here. So if you're listening to this,
yes.
I'm very competitive, so it's tough to give away some of these secrets. But we do a lot of what we call tech scouting. And Children's Nebraska is very intentional about providing opportunities for all of our employees and our staff to really have exceptional education benefits, to be out there and do the tech scouting and to look for the things that maybe are in a consumer market that would have applicability into the healthcare space. And so the holographic idea actually came from the Consumer Electronics Show. And me being a nerd, and I surround myself with, a lot of our super smart providers who are very in tune with that type of technology. We read an article in, I think it was The Verge.
Yep.
And they had first introduced this technology and we're talking about it. I said, wow, what a transformative way that could be to offer a behavioral health visit, because it feels real. I can't imagine being a parent or a child kind of in a really tough situation and having to talk about maybe my anxiety or something that really I'm kind of challenged with, and having to do it over Zoom. Zoom's great, but I don't know if it's the best paradigm to have exceptional care. And so we want that human touch. And anywhere we see a convergence in the consumer market between technology and a very humanistic touch, those are the places that are really attracted to taking a closer look at.
Yeah, it's really interesting, and it's behavioral health among pediatrics. It's such an important topic. We've all read the
Yeah.
data coming out of the pandemic too. I had not heard that statistic that the demand could rise potentially by as much as 50%. So such a core foundational element to raising healthy and happy kids, and really wonderful work there.
And
Um,
the stigma's gone too, right?
that's
I
right.
mean, I'm a Gen Xer, so I'm the generation of Tony Hawk and VH1 and those cool things. And even in my youth, it was something that was viewed upon, with a negative stigma. So we're thrilled that we're starting to see that change and that viewpoint change, where people are looking at behavioral health as something that is essential. And everybody has challenges that they work with, and so we're on a mission to continue to change that paradigm and get rid of that stigma, because that's critical to the mix.
Yeah, absolutely. It's great to see sort of the tide shifting on that. That's for sure. I'm a little bit younger. I'm an elder millennial, so I'm right on the cusp there of the millennial and Gen X generations. But I can
If you
absolutely
like
relate.
Tony Hawk, it's cool. Like,
That's it. I
Gen,
played
Gen
Tony Hawk
Xers
Pro
all
Skater
about.
too. Like, I'm that old. I'm curious. So the partnerships that you're seeing and that you're developing, what's the source? Like, what's the market like in Nebraska and Omaha and sort of the surrounding areas that are sort of in the vicinity of Children's Nebraska, and how far out are you extending in terms of your investigation of potential partnerships, and where are you seeing interest from the market in terms of to your point, kind of people walking in the door? Where's it coming from these days?
You know, the statistic I mentioned earlier, kind of talking about that gap between the 1% venture capital research startup activity and the 22% that needs pediatric care, that really shapes what that looks like.
Yeah.
And so having great collaboration with the partners that we work with day to day, other children's hospitals throughout the world, that's essential for us to really have open, meaningful dialogue where everybody's working together to find those new and novel therapies that are going to be transformative and create really great health outcomes. Nebraska is a state where the population is growing
Yeah.
moderately, but not off the charts. So we really do look outside of the state to find the best of the best. And the partnerships that we see small, scrappy startups that recognize that there's both a tremendous market opportunity for them, but there's a tremendous opportunity to do what's right. And we see a lot of great companies with those younger generations where that's really important to them. One of the most positive things about millennials and nexters and Gen Z is one trait of that generation is they want to be connected with companies and jobs that have a social engagement component to it.
Right.
And so we see a lot of young companies that are really focused and want to develop those things. So we very much see the Mammel Innovation Center definitely as a global enterprise. We're focused on looking at expanding a lot of our programs. We have a very robust 3D printing and virtual reality program in our hospital, and we get attention from a global audience about that quite frequently, mainly because we're our own manufacturing center.
Right.
And that's kind of different, but we did that because it's best for kids. And so we're being very entrepreneurial. We're being very research focused. And I don't think, we would kind of put a box around Nebraska and say that's one and done. We're looking for certainly the Midwest region. We have a lot of collaboration, a lot of partnerships there. But really, we're open to startups. Come see us. Come partner with us. If you've got that idea, I want to hear from you. Ideas are my favorite thing.
Absolutely. It's that's where it all starts. It has to start with an idea, and it has to start with opportunities like you've created for funding and for access to providers and to patients and their families. So it's very symbiotic between patients, their families, the health system, the incubator, the startup. I have to imagine that it's a multi-legged stool there that we're building.
It's about being able to move from idea to action.
Right.
And so if you're listening to this and you're thinking, okay, I'm interested in starting my own innovation program, or I want to stand up my own innovation center, you really have to have a mechanism for support of an idea every step of the way. Because I'll bet you your organization, young or new, probably tried this before. And you have a lot of people with really great ideas that are frustrated that maybe were told no, or you have what I observe as heroic innovation. You have that one individual that puts on a superhero cape and then try and run it end to end. And if they get a different job or they leave your organization, there was probably no cross training, and you're kind of left trying to figure out how to support that idea. So with the Mammel Innovation Center, our innovation program, we have informal meetups. We have an annual hackathon, an innovation cup that we do. We formed an LLC. We have a research engagement with our university partner, the University of Nebraska Medical Center. So all of those things are essential for kind of a healthy ecosystem. So it goes from that spark of an idea all the way to an innovation. You have to think about each iterative step and how you're going to support that.
Yeah, that's that process, that structure, obviously just so vitally important, and that's where we see, I'm sure, some really wonderful results. As you look ahead, hopes and goals for the future of the Mammel Innovation Center, how would you sort of outline that, and what's your vision for it evolving over time?
Wow,
loaded question, just a little bit.
Yeah, it's a powerful question. And I kind of have to pause and center myself a little bit, because sometimes I can get a little emotional about that question, because it's a powerful thing for everybody that works on our team, and it's the fire in our belly that keeps us going every day. Pediatrics can be triumph and tragedy. You see both of those things in healthcare, and particularly in pediatrics. It's a very, very powerful thing. My boss, who's a visionary, his name's Jerry Vucek, and he certainly kind of conceived this whole idea of putting together an innovation program. And our president, Chanda Chacon, has been exceptional support. So we've had so much support along the way. And what they would say is no matter the investment, if one life is saved or one kiddo, if we did something positive for them, it's worth it. So we really try to be focused on the patients that we serve, understanding what the needs are today. And again, getting back to the right care at the exact right time in the exact right place. If we're thinking about those things, we'll be rocking and rolling. I'm a very competitive person, so I think it's moved beyond a personality trait. Might be a disorder, who knows? And so my dream for the Mammel Innovation Center is for that to be recognized, certainly across the country and across the world, as a place that has brought some of those great solutions forward and really help providers and nurses do their job best. It's shocking the burden that our providers have in terms of just transactional stuff. If we can lean on technology to solve that, and they get 2 more minutes with the patient, how incredible would that be? So it's funny. I worked in a startup for a while, and we used to joke, well, we're not saving babies. Now I am.
Right.
And there's nothing more powerful than that. There's nothing more rewarding than the privilege and the opportunity to work in pediatrics.
Yeah, I mean, it definitely hits differently. I mean, obviously, I think when you work in healthcare and you encounter other people in healthcare, I always say, that neurosurgeon probably could have been anything that he or she wanted to be. They could have worked on Wall Street. They could have run hedge funds. They could have made a lot of money, doing a lot of other things. But healthcare it's a mission and a calling. And it sounds like you guys are certainly in that camp as well. Yeah,
it's so motivating to just be surrounded by that energy. Young folks out there listening, making that career choice, there's a lot of great opportunities in pediatrics. It's not just nursing. It's not just specialties in primary care. It's technology. It's informatics. It's artificial intelligence. All of the things that folks are rightfully so focusing on for rewarding careers. Certainly Children's Nebraska is hiring those roles, and other pediatric organizations are as well.
Absolutely. That's a really good point in terms of, speaking as a marketing major from a state school in New Jersey with zero clinical background whatsoever, can't even pronounce a lot of the terminology. It is absolutely a rewarding thing every day to come to work, and even working on problems that aren't necessarily tip of the spear kind of things.
Right.
It really truly is. So I would certainly echo that sentiment about folks that are thinking about their career path, it's a really great spot to be. And hey, healthcare is not going anywhere, right? I mean, we're going to need it for the foreseeable future.
No. If you're worried about artificial intelligence taking your job, you don't have to worry about it in healthcare.
That's right.
We might be doing different things, but there's no shortage of opportunities. Even if I don't have a background in healthcare. Like, I started out directing music videos, and
Yep.
being a creative person. I thought I was going to be, famous that way, but didn't quite pan out. And happily, I found myself in this profession, and I can't see myself doing anything else.
That's right. I think a lot of people would share that sentiment as well. So in closing, anything else that you'd like to share with the community about, either the Mammel Innovation Center or anything else that you're working on that you're excited about? Anything at all in closing?
Well, just really grateful for the opportunity to tell our story and to talk about exciting things that are happening at Children's Nebraska. We're out there on the web, so anybody can kind of get on our webpage and take a look at news and events and things that are happening with the Mammel Innovation Center. Our grand opening is going to be August the 26th. We'll have lots of great activities throughout the week. But if you want to come visit us, if you want to engage with us in our program, we're pretty easy to find out there on the web. And my thanks to you for hosting this great podcast and to be a part of the digital healthcare experience. As you kind of grow your interviews, I've been listening to all the great content that you're putting together, and I think this is going to be a wonderful place to be to stay connected with what's happening with digital health.
Thank you for that. I really appreciate that. And, we look at it in a very similar lens. We're not Children's Nebraska, but, we try to do our part to bring people together and open up the dialogue and have the conversation. And frankly, it's a lot of fun getting to talk to folks like you and some of our other guests. So it's a wonderful thing. And we hope that people are enjoying it, and we're going to endeavor to keep it up. So appreciate those kind words. And Dr. Ryan Cameron, Thank you so much for joining us today. It was an absolute pleasure to talk to you.
Thank you. Hope to be back.
And also, thank you to our listeners. If you enjoyed the conversation, please like, subscribe, share to help us keep growing the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. And that's our program for today. And until next time, this is Chris Civitaris wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.